Hello, my name is Bridget Stewart, and I am the Program Coordinator for the Health and Community Wellness degree here at the University of West Georgia. I want to use this time in this presentation to offer some additional information about the Health and Community Wellness degree. Obviously, we have a website through our Department of Sport Management, Wellness, and Physical Education where you can get some information. But what I'm going to do in this informal presentation is to give you a little bit more specifics about the degree and some of the initiatives that we have going on and some of the future plans that we have going on for the Health and Community Wellness program. So what I'm going to do is I'm going to minimize and put myself sort of down in the middle, and I'm going to work from this presentation that you see. Of course, we have several faculty members that are in the college full-time, and then we have some individuals that teach with us part-time. And so again, my name is Bridget Stewart, and I am the program coordinator. We have Ms. Gina Brandenburg, Dr. Mary Beth Sloan, Christine Knoll, Tom Peterson, Jessica Aldridge, and Kimberly Bingham are our full-time faculty that teach in our program, and then Dr. Cecily Luncheon and Dr. Michael Chan Frazier also teaches for us part-time. When it comes to the mission of Health and Community Wellness, we're really a health promotion, health education degree. A lot of people ask me, is this a healthcare degree? And this is not a healthcare degree. We focus more on the prevention side, whereas healthcare typically focuses on taking care of individuals that are already sick. What we like to do is prepare students to be able to go out and promote good health and good practice, to educate on behavior change, and sort of try to get those individuals at the forefront so that they don't necessarily have to have use of health care if at all possible. So we really work with our students to go into fitness centers. A lot of them will go into corporate world to be worksite wellness specialist. Some will go into possibly private school settings. Some of them will go into hospitals. So there's a lot of different areas to go into when it comes to health and community wellness. It's a very broad degree, but our coursework within our degree is very specific so that you get several different entities when it comes to health and community wellness. Now, our curriculum is just like any other curriculum here at the university. Everyone takes a set of classes known as the core curriculum, and then we have what's called Area F, which are sort of courses before you get into the actual major. So for us, First Aid and CPR, we have our Applied Concepts of Fitness and Wellness, which really looks at where you currently stand with your own fitness and wellness. We have the intro class for health and community wellness, and then of course we have Anatomy 1 and 2. And then two courses outside of our college are the Introduction to Psychology and the Introductory Statistics course. And then once you have declared health and community wellness as your major and you have completed the majority of courses on the left-hand side of your program sheet, and have a minimum 2.0 GPA, then you can start taking classes on what we call the right-hand side of the program sheet, which is our professional content. Now, we do have national certifications built into our curriculum. Our faculty strongly believes that a bachelor's degree only is simply not enough, and we really preach to our students that the fact that you really need to have more than just the degree. Everyone who's going to be sitting there on graduation day is going to have the same piece of paper, and so those that can stand out by adding these certifications or these extra skill pieces to their set are really going to stand out. And so we have some national certifications built into our courses, meaning that we use that particular curriculum to teach that course, and then you have the option at the end of the semester to actually sit for that particular test at a discounted rate so that you can become certified. So obviously we have First Aid and CPR, which is an American Heart Association class. We have CMWL 4000, which is our exercise and wellness programming for special populations, or what we like to call our exercises medicine course. We have PHED 3230, which is exercise leadership, and that is through the American Council on Exercise's group fitness instructor, so that is the certification tied to that course. If you're looking to become a personal trainer, we have the American Council on Exercise, their personal training certification. And then if you're looking to become a health and wellness coach, we actually have ACE's health coaching certification built in. And then in our worksite wellness program, we have the ability for you to join and have access to several training modules when it comes to WellCOA, so the Wellness Council of America. Now, we do not have an internship tied to our specific degree. We have what is called service learning, and service learning is a course that really ties the learning objectives that are actually tied to the course with the application of the community-based needs. So obviously with service learning, there has to be a need in the community, and it has to be reciprocated between the student and the community partner, and there has to be that learning objective tied, and there has to be the reflection piece is really strong. So for us, we have CMWL 4102. We do offer that typically in the fall and the spring. And what you see on the screen is just some examples of some projects that some of our students have done out in the community or here on campus. Now, we also have an initiative that's part of Health and Community Wellness called Exercise as Medicine on Campus. This is an American College of Sports Medicine initiative underneath that umbrella, and it really calls upon universities and colleges to engage in the promotion of physical activity as a vital sign. And so we have an agreement with our health services and our counseling services department here that if they have identified an at-risk student that they feel would benefit from having an exercise prescription, something specific to based on their special need, if that would be beneficial versus prescribing pharmaceuticals, then we have the ability to refer them to a credentialed specialist here in the department. And our advisor for that program is Chrissy Knoll. So if you're interested in getting involved somehow with Exercise as Medicine, I would strongly encourage you to reach out to her. Now, up on the screen is just some of the professional organizations that we reference quite a bit in our program or that we have a partnership with. Obviously, American Council on Exercise, the National Wellness Institute. We do have partnerships associated with those two entities, but this is just a little, if it gives you a little bit of example, sometimes students will actually go to that particular website and look up that organization and look at their mission and their vision to give you a little bit more information about what they are associated with. So it can, it can give you a little bit of insight about our program just from looking at those organizations. Now, one that is a new feature for us is a tie with what is known as the National Wellness Institute's Wellness Promotion Competency Model. I have had the fortunate pleasure of chairing the Council on Wellness Certification Excellence for the National Wellness Institute over the past couple of years. And one of the things that that committee has done is to develop the country's first ever set of core competencies for wellness professionals. And so we do talk a lot about these competencies in our program, and we have key assessments specifically tied to make sure that our students are learning those knowledge, skills, and content pieces to make them the best possible wellness professional and the most prepared wellness professional, if you will. We also use another piece of assessment within our program that's called professional dispositions. Professional dispositions is something that we feel upholds the integrity of the profession. It also upholds standards for our students. We think it's very important for our students to understand that yes, you are coming to class and yes, you are being prepared to become a professional, but what does it mean to be a professional? So attendance, dressing appropriately, being respectful of diversity, all of those things we do assess our students on to make sure that they understand that just coming to class and leaving is not really enough. We want you to develop as a professional your time here, and so we use professional dispositions to do that. We also have a student organization known as SHIFT, and our students did develop this particular organization. They named it. They came up with all the information. So if you are a student that would like to get involved, and you do not have to be a health and community wellness student to do that, but SHIFT is really to look at how to stimulate, encourage, and enhance healthy behavior across campus. And so SHIFT obviously stands for Students Helping to Influence, Fulfill, and Transform. So if you want to get involved in a student organization, during your time here at the university, I would recommend you look into that one. That's a great one to look into. We are also developing our curriculum and program at our Newnan campus in Newnan, Georgia. And so we have all of our Area F courses currently offered and a couple of our professional content courses. And so we are in the process of trying to have health and community wellness at the Newnan campus full time. Now that's going to take a little bit of time to be able to do that. We obviously have to grow our faculty in that area, but we do have courses in Newnan. So if you are a Newnan-based student and want to stay a Newnan-based student in the future, it will be possible to have CMWL as an option. Now, when you look at the economic growth, we know that a healthier workforce, and so essentially why do we have this program? Why is it important? Well, when we look at individuals that can go out and help develop a healthier workforce, we know that that's going to equal a more productive workforce. So you're starting to see hospitals, companies, and schools that start to value the productivity of their people, their staff, their faculty, and how to do that is they need to become healthier. So, we feel that our program is critical in making a significant impact in this indirect cost associated with preventable chronic disease of $1 trillion a year. We feel like our students can prepare and go out and make a healthier workforce that obviously is going to be able to cut some of this cost. Now, this is just going to show when you look at the World Health Organization. States that good health is linked to economic growth, which we know that through higher labor productivity. We know that demographic changes and educational attainment, those are all sort of some social determinants of health. And so we feel like in this country that our students have the ability to make such an impact on presenteeism and absenteeism when it comes to the workforce. Most students want to know about job outlook, and so just to give you a couple of examples here, health educators and community health workers, which is the majority of what our students want to go into, or maybe even the fitness profession, but we know that 13% is higher average, so it's faster than average. Some individuals want to go and be a dietitian or a nutritionist, and we know that that field is growing as well. Exercise professionals, we know that that field is growing. So all of the areas within health and community wellness that we have researched, it's very clear, and there's evidence to show that those fields are growing much faster at a much faster rate. And so it's a very positive outlook for our majors. A couple of other job opportunities: public health nurse, improve community health. So individuals that obviously would go into nursing can obviously work at government agencies or community health centers. We got health promotion program coordinators, so they sort of oversee planning and management of public health promotion programs. They do a lot of educational material preparation. They do a lot of grant writing. We have health and wellness manager. So health and wellness managers typically analyze data in health issues and give populations and design intervention programs to really address those. And so those are just a few of the job opportunities and how quickly they are growing when it comes to health and community wellness. Now, we got a couple of things going on in the works. Obviously, our program is going to continue to work towards national accreditation through the National Wellness Institute, obviously to maintain those high professional standards, but also to make sure that our students can actually have credentials when they graduate just from going through our particular program. And so if we have that accreditation that actually occurs, then we can have our students actually receive a certified wellness practitioner credentials. We're looking to possibly design and open a comprehensive wellness center here in the Coliseum. We're just sort of in the beginning stages of planning for that, but we would open that up to faculty, staff, and students on campus, and then ultimately to the community at need, and be able to work with those individuals that truly may not have access to be able to get the health education that they need to really make a turnaround with their health. So we would be sort of their shop for that, to be able to get the education, get the screenings, and really improve their overall health. We will possibly have a minor for health and community wellness, so other students on campus can actually get a little bit of an experience. And then, of course, we are in the beginning stages of looking at a minor in nutrition, so we're underway in being able to design that program as well. And so that concludes the information about health and community wellness. Again, you can always go to our website and be able to get our program sheet. And of course, you have my information up on the screen that you can email me as well if you have other questions. And so I hope everybody has enjoyed this presentation, and have a good day.